Hello, everybody, and welcome back to our series of videos on our anatomy and physiology. So, we're drawing to the close of our anatomy muscles videos. We've just got two more, upper leg and lower leg, and you'll be really pleased to know that both of them are short. Just two slides in this one because we're just going to be looking at our quadriceps and our hamstring. So, hopefully, some familiar territory for you all. So do keep your ears open for those muscles that are two joint muscles. I've been having a look through some of the exam papers, and often they like to ask about which muscles are two joint muscles. So if you remember in our last PowerPoint on the muscles of the hip and the pelvic girdle, sartorius was one that came up a number of times. That longest muscle, the talus muscle, that's a two joint muscle. Okay, so here we've got another one coming up. So quadriceps, one of the most powerful muscles in the body as a group, and it's actually the most voluminous muscle. It's got the greatest volume of any muscle group in the body. So predominantly, this is a hip flexor and knee extensor, and it's comprised of four individual muscles. So we've got three vastus muscles, and we've got one rectus femoris muscle. So these muscles together form the bulk of the thigh, and as I've said, is a very powerful muscle indeed. So it's in the anterior compartment, and the origin of the majority of these muscles, the three vastus muscles, is on the femur, but the rectus femoris is a two joint muscle, and it starts on the iliac spine and the top of the acetabulum. And the acetabulum is part of the pelvis. It's the socket that the hip bone, socket of the hip bone that the head of the femur fits into. So that's where the rectus femoris starts, up on the spine, the iliac spine and the acetabulum, whereas the other three start from the femur. These four muscles combine proximal to the knee to attach into making the patella, attach to the patella via the quadriceps tendon, crossing the knee, all of them, the hip, just rectus, and the joint action is that all four of them extend the knee, and the rectus femoris also flexes the hip. So those are our quadriceps muscles. You can tell from the names that vastus lateralis, and from the image, is the most lateral muscle, intermedius in between, and medialis on the middle, on the inner side of the thigh. And rectus femoris just goes directly down the front of the thigh. So for our final slide already, we're going to be looking at the hamstring group of muscles. So the hamstrings are a group of three muscles that predominantly work to flex the knee, but also have some hip extension action. They're all two joint muscles, so they all cross the hip and the knee. So all three of them, their names are biceps femoris, semimembranosus, and semitendinosus. All three start on the ischium. It is actually the ischial tuberosity, and except for the short head of the biceps femoris. Now, by the name femoris, we know that it's by the femur, whereas remember there's also a biceps brachii that's to do with the arm. So when you see biceps, check what the second word is to check whether it's of the arm or of the leg. So biceps, we know, means two heads, and there's a long and a short head of biceps femoris. Long head starts at the ischium, ischial tuberosity. The short head starts halfway down the femur. They insert into the tibia, semimembranosus and semitendinosus, whereas biceps femoris inserts into the head of the fibula. Their joint action is knee flexion and some hip extension as well. They all have quite long tendinous insertions and origins, which you can often see, and those tendons merge in with the muscle belly. So these are long muscles, the three that form the hamstrings on the back of your thigh: biceps femoris, semimembranosus, and semitendinosus. And you'll be glad to know that is all the muscles of the upper leg: hamstrings and quadriceps. All right, see you shortly for joints for the muscles of the lower leg. Thanks then.